everyone, Nikki here with the Chuck Boss Show. Today we're joined by our friend Dr. Dixon. Hi, Dr. Dixon. Thanks for joining us again.
Thanks so much for having me.
No problem. Dr. Dixon is a certified medical examiner, chiropractor, as well as a registered dietitian out of the TA with Drivers Health Clinic in Wildwood, Florida.
Yes.
Today we're going to talk about maybe not such a popular subject when it comes to drivers on the road, but it's definitely an important one. So, Dr. Dixon, today we're going to talk about supplements. How important are vitamins and supplements to drivers that are on the road for long hours that are maybe not the most health conscious?
First of all, their diet is not fantastic. Not to lump everybody together, but the produce isn't exactly ample, and even the stuff they're getting, it's not great. So if you're not getting your fruits and vegetables that have come from a farm that actually cycles out where they place them and moves them around, they're not getting the nutrients that they used to. An apple today has like a quarter of the nutrients of an apple 25 years ago. So with that being said, when I was in school to be a dietitian, we said, you don't need to supplement. Well, so much has changed in these times. We just don't get enough out of our food anymore. So there's some key supplements that need to happen, but it's really important because if you're not hitting all of those bases, your body's not going to function properly.
Well, we all know that there are tons of different brand names and supplements out there. Are all supplements created equal?
No, ma'am, they are not. So you definitely get what you pay for. There were studies out there, one recently on TV, where they had checked aloe products, and I'm not going to say where they went to get them, but they went and got a bunch of them off the counter, and they tested to see how much aloe was in there. Was there any aloe in there? We're talking a liquid aloe that they were taking, and in there, some of it was just food color, green food color. Some of it had a little bit in there. There's no regulatory factor out there to state that all of these things have to have what's in there. So if you don't buy them from somewhere reputable or know, the manufacturing process, you may not be even taking what you think you're taking.
Wow, that's definitely true. A lot of people take supplements not even knowing maybe like if they need them or if they're just kind of going straight in and straight out. So
Absolutely.
it's pretty important to know what you're putting in your body. What basic supplements would you recommend for beginners?
There's 5 that I take regularly. And so first is a quality multivitamin. You want something broad spectrum that's going to cover everything, at least in a little bit. So if you missed out on one small supplement or one small type, that broad spectrum is going to fill it. But then I focus on vitamin D. And so you want vitamin D3. It actually is the animal type vitamin D, and your body accepts it more. So it's much more absorbable. Vitamin D3 affects so many people, and brain processes and brain fog and memory. And there's a whole host of other things that it does, bones and nerves. And it's just very vital. And we say, well, I'm in the sun enough, I can get my vitamin D. But the problem is most of us are so deficient. A study I read recently said that 90% of the American public that has darker skin is deficient in vitamin D. And then also 70% of our lighter skin Americans are also deficient in vitamin D. So just taking it thinking, well, I got a little from the sun, a little from my diet is not enough anymore. And you definitely need vitamin D. The next one that I talk about is magnesium. And magnesium is huge. Most of us are deficient in that as well. And that's vital in your bones and your GI tract and your muscles and your nerves. And the problem with that is you can test vitamin D readily in a blood test. It's fantastic. But you go to test magnesium and your bone actually is a storage place for it. And your body won't allow your blood to become depleted. So in that factor, it's going to deplete the bone over and over and over to keep that blood where it needs. So you get that blood test and all of a sudden your magnesium looks fine. Well, I don't need any. Well, that's because it's leached it from the bone. So magnesium is great. The other key with the drivers is if you've got constipation, magnesium's fantastic. So there's really not a side effect other than diarrhea by taking too much magnesium. Fantastic cure for a problem that a lot of our drivers have. Fish oil, vital for your eyes, for your brain, and just overall health, skin. And then the last one that I am a huge fan of is a glutathione enhancer. So glutathione's the master antioxidant of the body, and it actually will push all the toxins out of your system. But you need the enhancer. If you just run to, the vitamin store and you buy glutathione, it's a tripeptide and it'll break down in your gut, won't do what you need. So you need a glutathione enhancer. And those are the 5 that I live by.
Nice. If I'm not mistaken, you have written an article about supplements. Is that correct?
I have, yes. I wrote an article in Landline Magazine. It was in the March of 2018 edition, and I go over extensively all of those.
Nice. Well, Dr. Dixon, like always, it was a pleasure talking to you and getting your expertise on supplements, because it is very important to know what you're putting in your body and getting the correct amount of vitamins and nutrients that your body needs. So if anybody is interested in contacting you, where can they find you?
You can find me at the TA in Wildwood. I'm inside the truck stop at exit 329, Highway 75. You can also find me on Facebook at Drivers Health Clinic. Find me online, drivershealthclinic.com. Call me, 352-643-1034. And then you can always email me if you need to. It's Dr.Dixon at drivershealthclinic.com.
Awesome. Well, there you all have it. See you on the next Truck Boss Show.